Hello everyone. I wanted to take a moment to give you a few examples on what the expectation is for your PowerPoint presentation. I'm going to give you 3 examples. I'll give you a grade A, a grade C, and a grade F. I'm going to let you decide which condition you feel earned what grade. I'm going to start off with this one and you'll get to watch it in its entirety.
Anencephaly. What is analepsia? Analepsia is a defect in the formation of a baby's neurotube during development. This occurs when the upper part of the neurotube does not close all the way. Analepsia is caused by neurotubes failing to close during the first weeks of embryonic stage. What is analepsia? Analepsia is the most severe fetal neurotube defects resulting from failure of the neurotube to close at the base of the skull in the 3rd or 4th week after conception, leaving the skull bones that usually surround the head unformed. What are the type of symptoms that may occur? Analepsia is the absence of a major portion of the brain, skull, and scalp that occurs during embryonic development. This disease is a serious birth defect in which the baby is born without a brain. What are the type of symptoms that may occur? Absence of the bony covering over the back of the head, missing bones on the left side, right side, and the front of the head, folding of the ears, congenital heart defects, facial feature abnormalities, and heart defects. What are the type of symptoms that may occur? Cleft palate, a condition in which the roof of the child's mouth does not completely close, leaving an opening, can occur at the same time with analepsia. Some basic reflexes such as startle reflex and suck reflex, missing large part of the cerebrum and the cerebellum in the brain, trouble with thinking, hearing, vision, emotion, and coordinating movement. Bones of the skull are missing or incompletely formed. Treatments. Unfortunately, there is no known cure for analepsia, but the goal of treatment and care is to help the baby feel as comfortable as possible at its initial passing. There is an ethical treatment, which means you try to do everything that's possible to feel comfortable. Babies that are born alive die shortly after birth, typically less than 1 day, due to sepsis, pneumonia, or atelectasis, rather than from endocardial causes. Treatment. There is a support groups, for example, a photographer called Now I Lay Me Down to Sleep that gently provides a helping hand and healing heart to parents experiencing an early infant loss. Grief counseling services are available to help the parents with the loss of the child. The parents are recommended genetic counseling for future pregnancies. Treatment. Some diseases have therapy, so that way the baby can feel better, but for this disease there is none. One of the treatments for the baby is to keep them the warmest you can, so that way they don't feel cold. Since they are so small, they feel everything. For this, they are most likely recovery treatments for the parents, since they will lose their baby and you can't really do anything for the baby. This is very hard for the first time mothers, since they can get traumatized. What type of prognosis will occur? The prognosis for babies born with analepsia is extremely poor. Stillborn. Babies that born alive die shortly after birth, typically less than a day. About 25% will die after birth. What type of prognosis will occur? Roughly 26% will die within an hour. Statistics suggest that 95% of the babies born with analepsia will not survive more than a week. Miscarriage of the fetus, also known as a spontaneous loss. Neonatal death, which means it's death in the first 27 days of. What type of prognosis will occur? Results in baby born without forebrain, born without the ability of thinking and coordinating part of the brain. Advice and counseling for abortion is to be given to. What are some interesting facts? Babies that born alive die shortly after birth due to sepsis, pneumonia, or atelectasis, rather than from endocardial causes. Since the United States began fortifying grains with folic acid, there has been a 28% decline in pregnancies affected by neurotube defects. Women who ingest folic acid before and during pregnancy greatly decrease the chance of their child being born with analepsia. What are some interesting facts? CDC estimates that each year about 3 pregnancies in every 10,000 in the United States will have analepsia. This means about 1,206 pregnancies are affected by this condition each year in the United States. In some cases, analepsia is diagnosed until the baby is born. Analepsia cannot be fixed with a surgical procedure. The highest incidence is in Great Britain and Ireland, and the lowest is in Asia, Africa, and South America. What are some interesting facts? A family history of spina bifida or analepsia is one of the strongest risks for reoccurrence. Most babies that have analepsia are smaller than a regular-sized newborn baby. Therefore, organs that the baby may need cannot be donated due to the baby's size. If you are a mother that is expecting a baby with analepsia, you will get a pregnancy counseling during pregnancy and after birth. 6 times more frequent in white than in blacks, and females are more often affected than males. What are some interesting facts? There is a higher risk for Hispanic mothers to conceive a baby with analepsia. Some of the risks for a mother are maternal diabetes prior to conception and maternal obesity. The doctor suggests that before you decide to have a baby, to take a month prior to a month supplement of folic acid to prevent this disease. Are my pictures and sites used and my citation.
Alright, there was one. Here's going to be the next example.
Amyotrophic lateral sclerosis, commonly known as ALS. This is a disease of the nervous system. The formal definition of ALS is a severe weakening and wasting of the involved muscle groups, usually beginning with the hands and progressing to the shoulders, upper arms, and legs. It is caused by decreased nerve innervation to the muscle groups. Breaking down the disease name into its different parts, we see that A means without, myo refers to muscle, tropho means development, and the suffix ic means pertaining to. So essentially, amyotrophic means no muscle development. Lateral refers to the area of the spinal cord where the brain tells the muscles what to do. And sclerosis means a hardening condition. The illustration on the right shows the difference between a healthy motor neuron and one affected by ALS. In ALS, the motor neurons that send signals to muscles to contract die, resulting in reduced muscle stimulation and the inability to control voluntary muscle movements. Here we see a further illustration of neurons affected by ALS. The symptoms of ALS are a gradual onset. Patients may either have a bulbar onset, which means that they will first notice symptoms and difficulty with swallowing, eating, speaking, or breathing, or they will have a limb onset, which means that patients notice difficulties first in their limbs. There are 2 types: familial, which means it's inherited from the person's parents, and sporadic, which accounts for 90 to 95% of cases and means that the disease appears to occur at random. Not everyone experiences the early symptoms exactly the same. Some early symptoms include dysphagia, dysarthria, limb fatigue, muscle cramps, difficulty in holding objects, and dyspnea. Patients typically end up on a breathing machine because of dyspnea. There are a few treatment options for people with ALS. The medicine riluzole appears to slow the disease progression in some people. Edaravone has been shown to reduce the speed of decline of daily functions for people with ALS. Other treatment options include breathing treatments, physical therapy, and occupational therapy. It is important that patients and their families take time to grieve upon receiving their diagnosis. It also helps to find support groups so that patients with ALS will not feel so alone in their journey. The average life expectancy of patients with ALS is 2 to 5 years, although some people actually live longer, especially if they are diagnosed before the age of 40. Patients will notice gradual muscle failure, and this will eventually lead to full body paralysis. Sometimes there are brief periods without further loss of function. However, any significant improvement occurs in less than 1% of patients. Unfortunately, ALS is fatal, and many people actually pass from respiratory failure. Patients with ALS may also experience anxiety and depression, which is true with any disease. In fact, some patients actually do show cognitive impairment. In fact, 14% of those diagnosed develop frontotemporal dementia, and this leads to a shorter survival. ALS was first discovered in 1869 by French neurologist Jean-Martin Charcot. However, it wasn't widely known until Lou Gehrig was diagnosed. Lou Gehrig was a famous baseball player who made the disease famous. In fact, ALS is commonly referred to as Lou Gehrig's disease. This baseball star was known as the Iron Horse for his batting average and longevity. Gehrig was diagnosed in 1939 and passed away in 1941. Stephen Hawking also had ALS. This British physicist had a rare form of the disease. He was diagnosed at age 21 and lived with ALS for 5 decades. Hawking was eventually wheelchair-bound and spoke through a computerized voice system. Every 90 minutes, someone in the U.S. is diagnosed with ALS. Military personnel are 2 times more likely to develop the disease for unclear reasons, and in fact, ALS is a service-connected disease. The Ice Bucket Challenge helps to raise awareness for ALS by raising money for research for a cure. In 2014, it raised over $115 million, and everybody around the world participated, even celebrities. Not all diseases have a cure, and ALS is proof of that because it is irreversible and fatal. All we can do is to be supportive and offer help when we can, and also to help raise awareness.
Alright, that was our second. Here's the last example I have for you. Now this one's going to be different because, as you can hear, there is no narration on it. And it's not progressing because it's not got the auto progression, which I will show you in another video. So I'm just going to go through it. As you can see, very general. This particular example only has 16 slides. And if you've read your rubric, you know that that's not enough. I'm just progressing through it. I have some cute transitions in here, but not sure that's going to help so much when it comes to grading. And only 2 references. Alright, if you have any questions, please feel free to email me. I hope this answered some of your questions. Again, like I said, I will post a separate video showing how to add in the narration for voice and how to do your auto progression.